Good morning. My name is Bethany Doherty, and I am a program coordinator for OneOp. It is my pleasure to welcome you to today's session on innovative ways to integrate apps into clinical practice. In case you are joining us for the first time, I would like to give a brief tour of our webinar platform so you can find your way around. Hopefully, you are currently able to view the slides we are sharing. If you are unable to see them or have any other difficulties, please email us at contact@oneop.org for tech support. As some of you have already done, we look forward to having you join us in the chat pod for conversation and questions. Several people have already shared the location they are joining us from today. Please continue to do that if you'd like. To embed the chat pod so you don't miss any links or conversation, simply place your cursor over the shared slides. You will then see a toolbar pop up across the bottom of your screen. From there, just click the chat bubble icon. When typing questions or comments, please be sure to select everyone from the response options drop-down menu so everyone can view them in the chat pod. Note that the slides and resources are available for download on the event page for today's session. We will be covering continuing education information at the end of the webinar, so please stay tuned at the end if you're interested in continuing education credits or a certificate of attendance. Closed captioning is available for this webinar. You can turn on the subtitles via the Zoom toolbar. If you need to step away from today's webinar at any time, note that a recording will be available for review within 2 business days on the event page. Thank you for joining us as we continue our partnership with the Department of Defense and the U.S. Department of Agriculture to expand the readiness, knowledge, and networks of the professionals supporting our military service members and their family. Today, I am very pleased to introduce our speaker, Rachel Stahl-Salzman. Rachel is a lecturer in medicine in the Division of Endocrinology, Diabetes and Metabolism at Weill Cornell Medicine. Rachel is passionate about empowering people with diabetes to develop sustainable lifestyle changes and leverage diabetes technology and digital health to improve their health and quality of life. In her clinical role, she provides diabetes self-management education and support and medical nutrition therapy for adults in both individual and group settings. She has additional roles as lifestyle coach and coordinator for the hospital's diabetes prevention program and endocrine preceptor for the New York Presbyterian Hospital's dietetic internship program. She is actively involved in interdisciplinary education, especially as it relates to nutrition, diabetes management, and technology. Rachel currently serves as Technology Chair of the Diabetes Dietetic Practice Group of the Academy of Nutrition and Dietetics and is the proud recipient of the 2022 Rising Star Award from the Association of Diabetes Care and Education Specialists. I do want to note before Rachel begins that this presentation is not endorsing any brand, company, or mobile application. And now I'll turn it over to Rachel to start the webinar.
Great. Thank you so much for having me. It's really such a pleasure and honor to be here today. And I'm looking forward to some good participation. We've got some poll questions. We've got some chats. So feel free to stay engaged as possible for today. For me, this topic is near and dear to me. What started out as an interest in apps soon became a necessity. I get questions all the time from the people that I care for, coming to me already using apps or asking me about what apps are out there to help with my specific condition. So I knew and really understood more and more that this was an area that we as registered dietitians and other healthcare professionals on the call today can really learn to appreciate and understand. So I'm looking forward to sharing some key features with you today. These are my disclosures, and throughout the presentation, I'll be showcasing different apps, but it's truly for educational purposes, not endorsing any brand, company, or mobile app. So today's learning objectives, I want you to think of it as a two-part in our hour today. We're going to first be covering the science, looking at the current app landscape with a discussion on some of the benefits and challenges. And then we're going to take a pause, we'll answer some questions, and we're going to turn the second half of the presentation into the art of app integration, where I hope that you will gain knowledge of integrating apps to lead data-driven discussions through real-world case studies. So let's get a feel for the audience here. With a poll question, do you recommend apps? Please answer A, yes, or B, no. And we'll give it 10 seconds and we'll see what the answers are. Okay, excellent. So as you can see here, an overwhelming majority of you do use apps in practice, with 84% of you indicating yes and 16% no. So let's take it one step further. On this next slide here, if you answered yes, I am so curious, which apps do you recommend? And this is a great opportunity for you to share with your peers which apps you're using, which apps you're thinking about, which apps you like. We can all learn from each other. So please share in the chat and we'll give it 15 to 20 seconds or so. Okay, I see MyFitnessPal, Lose It. All right, now things are coming through here. I can't keep up with it here. So Bethany, you might need some of your assistance. Getting some good responses.
Sure. We've got Nourish, Lose It, CGM apps, My Net Diary, Samsung Health, Eat Love, another My Net Diary, Apple Fitness, Calorie King, Nike Training Club, Daily Dozens, Carb Manager.
Excellent.
Great.
Really, really great responses. I'm curious, Daily Dozens, if the person could share what that app is. I feel like we're always learning from each other about all the different apps out there. And I saw a lot of common ones across the board and some other ones across the realm of nutrition, physical activity, glucose monitoring. So as you can see, a lot of different apps and applications to use them. Okay. So where we are now, we are in a digital health revolution. Recent years have brought tremendous growth in the number of companies offering digital health, and apps are a part of it. Let's look at the past over on the left. Those coiled wires that we would use to download glucose meters, or all the paperwork that would accumulate in our office, or all the paper handouts that we'd provide to patients. These were often hard to store and easy to lose. And look where we are now over on the right. We have various connected devices, such as products like a ring that tracks sleep and activity, to telehealth platforms, and Bluetooth-enabled glucose meters transferring data directly onto the patient's smartphone. These digital technologies are reshaping healthcare through accessibility, innovation, and personalization. And all of this works to ultimately improve patient outcomes. With more people than ever using apps, we can think about the patient journey and how apps could be used at each turn. If we were to follow this path, and think of our person here over on the left, from the moment that they find out they have a new health condition in the awareness section, they might go on an app to learn more about it. And then on to help, maybe looking for an in-network provider through a hospital system or their insurance app to identify who that they can meet with. And then on to care, using a telehealth platform to see their healthcare professional for guidance. And on to treatment, apps such as GoodRx, where users can find the best cost for certain medications. And then on to monitoring, behavior and lifestyle change, and ongoing care apps. These are apps that can help people manage their conditions between office visits, which we know is so incredibly important because most people aren't spending a lot of time at the doctor's office. So this is so important when we consider that there are apps at each step of that patient journey. So where do apps fit in? Apps fall under the umbrella of digital health. And digital health refers to the use of connected devices and technology-based communication to improve health, which includes, but not limited to, consumer wearables, you could see up at the top, connected biosensors measuring physiological parameters, on-demand telemedicine, and mobile apps, right? The discussion for today, which happen to be the most widely available and used digital health tools. And I'll never forget a talk I heard from Dr. Daniel Kraft. Please feel free to Google him. He is known as the healthcare futurist. And I heard him speak at a healthcare conference last year. And he made such an impression. He was probably wearing 30 different wearables. He's got the ring, he's got bracelets, he's got things on his clothing. And he really conveyed to us the importance that all these wearables, gadgets, and apps are poised to empower individuals to gain insight into their lifestyle patterns. And through algorithms and through insights, provide information to help support their well-being. And he really sees the future where these tools are going to be embedded in everything, believe it or not, including our refrigerator and even mattresses. So stay tuned. We'll see where that goes. But it can be overwhelming thinking about the sheer breadth of health apps out there. I did a quick Google search, best health apps, and guess what? There were over 3 trillion results in less than half a second. The sheer breadth of these apps makes it difficult for both the people we care for and us as healthcare providers to sort through the vast and overwhelming, what I call jungle of digital solutions. It can make anyone's mind spin. The fact is there's over 350 health apps available in app stores, and people are using them, with 2 in 5 US adults using some sort of health app. There are also 3 health conditions that account for nearly half of all disease-specific apps. So I want you to think for a moment and use this as your next poll question. What can you think of are the largest health condition categories of apps? Is it A, mental health, cancer, and musculoskeletal? B, mental health, diabetes, heart, circulatory system? C, digestive health, respiratory, pain management? Or D, diabetes, heart, kidney disease? What are the 3 largest categories? All right, let's see those results. Okay, so we have the majority of you at 66% said B, mental health, diabetes, heart, circulatory system, with the second runner-up being D. So the answer is, let's take a look at the next slide. And hopefully you didn't take a peek at the slides just to find the answer, because it is on the next slide here. We have our 3 top disease-specific apps. Number 1, mental health, representing 22% of all apps. Diabetes comes in at a close second, and heart, circulatory system, third. So think about it. Think about the people that you care for. Think about your patients. Are they having some of these health conditions? Because there are a breadth and a large variety of apps that may be able to support them. Let's next consider the categories. When I think about recommending apps, it's important to kind of understand the different categories. The first, our categories, is really kind of, I consider it more the general wellness, which primarily is user inputting data. So person-generated health information like tracking nutrition, activity, or sleep. Then we have apps that display, download, or use data. And this is typically coming from medical devices that diagnose, prevent, or monitor or treat a condition. So someone had mentioned earlier, wrote in the chat about like a CGM. That's taking physiological data and displaying it onto an app. So that would be an example there. There's also health management and education apps, which are a little bit more comprehensive than the typical just a general like food tracking, for example. Maybe it's specific for a certain condition like heart disease or pregnancy. Maybe it offers a sharing feature so that the healthcare provider can review the data to help provide important insights. And lastly, there's apps that function as what's called software as a medical device. And this includes apps that are used to diagnose, treat, and prevent disease. An example here could be an app that's used for dosing or titrating insulin. These types of apps are regulated by the FDA, and we'll talk a little bit about that later, as medical devices and must meet certain criteria for safety and efficacy. Now let's think about and review some of the benefits of apps. How can these be helpful in our practice? Let's take a look in the past, or maybe, so to speak, the not so distant past. When we look at all those coiled wires, and yes, this is actually a true picture of my office in the past, where we had all these wires for different glucose meters, different devices. We had patients keep these detailed food logs, which were very hard to read. I give anyone extra credit here if you can decipher exactly what this says and make recommendations from it, right? This is very challenging and difficult. But now with advancements in digital health tools, we can pull data from the glucose meter that can be put right onto a connected app. And this could really help to simplify that data download and tracking. So here in this example, you could see that for the person with diabetes, it offers some important insights. You can see there's color coding with the glucose value, so they can quickly identify readings that were in range and readings that were out of range. They could add additional context to the data by simply entering how many carbs they eat or what food they had. And to take it one step further is the app could start to understand patterns. So here in this example, I know it might be hard to read on your screen. It says, recognized a pattern. Your blood sugar has been high between 7 and 11 p.m. And the person could click into that and it could offer some ideas and advice like why that could be happening to give them important feedback in the moment, right? That day-to-day support. And for the healthcare provider, it can be incredibly helpful to have accurate data, to have reports that make it easy to interpret all of the glucose data, which eliminate concerns about data entries, illegible handwriting, and concern of people forgetting their logbook or their meter at visits, which I'm sure many of you might be able to agree with. So this helps tremendously to see it for both the person and the healthcare provider. Apps also can help inform decision-making. One example here is an app that provides guidance to minimize risk specifically for FODMAP. And someone had mentioned the Montage app as one example here that's providing people with simple color coding to know which are the foods that are going to help support their low FODMAP meal plan and which foods are going to be a little bit higher and should try to be limited. In this other example, this is an example of a mindful eating app. It offers additional insights for the person to, again, input information about their food. So for example, the person could input which meals they ate for reasons related to, were they true hunger? Was it more of a social setting and they might have felt inclined to eat something that maybe they didn't really need? Were they eating because they're stressed, tired, or bored? And the person could look back in the app and identify which were the meals did they eat for those specific reasons that, again, can support the mindful eating if that's the specific process that that person is working with. And a third example are how apps can drive engagement to support positive behavior change. In this example here, the person is getting a notification directly on their phone from their Fitbit app that's saying you're almost there, get 1,067 more steps to hit your daily goal. This can be incredibly encouraging. You know, I think about a patient I had who was putting her son to sleep and she literally got this notification and it encouraged her to go up and down the stairs, circle around the floor a little bit more to get her steps in, which is really just shows the example of that engagement. Another example is goal setting and tracking. And this could be incredibly helpful as well to support your visits with the people that you care for. Let's say you're working on a goal with the person, you set the goal, you write it down. They could then enter it into, depending on the app, to track it and be able to every day kind of identify were they achieving their goals, what were some barriers. So that can also be very helpful for them too. And a third example to help drive engagement is coaching. And feel free to share in the chat if you've heard of different apps that have either live dietitian coaching or maybe a health coach, or maybe it's an AI chatbot as we're seeing growth with AI to help support people, again, in those day-to-day decisions between your visits with them, which can be helpful to have connection, have that additional support. Despite all these benefits, we do need to acknowledge that there still are challenges. And so what I want to cover here are these two important challenges to acknowledge: limited clinical data and privacy, security, and safety concerns. So there are considerable gaps on the evidence of apps. There are few randomized controlled trials, the gold standard, right, of studies to support effectiveness of apps in improving health outcomes. Most studies are often unblinded because it's hard to create a good control group that accounts for what people call a digital placebo effect. Moreover, other reasons for such limited studies are that clinical trials are often costly for most software developers. And a lot of these companies might be small startups that really don't have the amount of money to run through a whole IRB study. Additionally, the technology changes very fast. There could be, as you guys know, with apps, there's always new app features, getting the bugs out of different apps, that to be going through an IRB study, it has to be exactly the same when it started. So that's limiting given the amount of time of a duration of a study. Small sample size and short duration are also limiting factors to support the evidence of apps over time. Most systemic reviews looked at data from anywhere from 2 to 12 months. And when we're thinking about digital health tools being utilized by employers, by health insurance companies, by hospital systems, they want to see data of these apps over the long term. They're not here, it's just a short-term thing. So it's really important to help really kind of find the main factors of apps that can help support their use over time, making sure someone would continue to use it and gain continued knowledge through its use. There's also considerable evidence gaps across different populations. And overall, these measurable measures make it challenging to generalize study results. Over on the right, I want to highlight a consensus report from the European Association of the Study of Diabetes and the American Diabetes Association that put together a report on diabetes apps. And it really reviewed the landscape. This came out in 2020 and was the first of its kind to focus specifically on apps alone, right? There's so much technology within diabetes alone, but to have a paper exclusively on apps, I think really just goes to show the importance that this is a field that's growing, that we need to be aware of, and what are next steps. So they call for a commitment here from several stakeholders and the diabetes community at large: regulators, industry, clinical experts, people living with diabetes, to help apps overcome some of these challenges. So I'd imagine we're probably seeing similar things coming out in other health conditions as well. And feel free to share in the chat if you're aware of consensus reports in other health conditions related to the apps. All right, and the next challenge here are that apps have privacy, security, and safety concerns. Unlike a medical device like a blood pressure monitor or an insulin pump, the majority of apps are not regulated by a governing body, such as the FDA. Without oversight or regulation, there's higher risk. The app might not perform the advertised function, it might present potential cybersecurity risks, or it might lack safeguards to prevent harmful mistakes from operational error. An example here of that would be an insulin bolus calculator app that is not FDA regulated. Can you just imagine if someone accidentally put in their glucose value of 1,000 instead of 100 and asked the app to calculate how much insulin it should take? That can be very dangerous for the person. They could potentially overdose on their insulin and lead to significant hypoglycemia. So safeguards for those types of factors must be regulated. Additionally, data privacy is not always well protected. Some apps transmit consumer data to third parties, might lack encryption, and others don't even have a privacy policy. And lastly, there's no regulation on the quality and accuracy of information circulated via online communities and peer support. While these communities provide valuable support network for users and the potential for really helpful advice, misinformation can also circulate due to limited moderation and oversight. You might have had similar patients that have that like mine that come to me after reading through group discussions on, these crazy supplements to cure cancer or restrictive diets and cleanses that claim to erase all the pounds. We need to educate people that what they read about on these community boards might not be appropriate for them and can actually be harmful. And an example that I have that I was just thinking about is I had a person who's using a fitness app. And on the app, it suggests to them all these different supplements to take. And without really knowing the person's medical history, it can be worrisome for the person to be choosing to use all these supplements without the oversight of a healthcare provider. So it's really important for us to even ask. Maybe we don't even know that they're using an app and getting information from it. So making sure you ask that in your assessments can be very helpful too. So with these challenges, the FDA has come into play. And I really want to highlight here that the FDA regulates a small subset of apps that function as medical devices. And this unfortunately leaves a large gap of apps that might pose risks. But in an effort to protect the health and promote public health, in the past few years, the FDA launched the Digital Health Center of Excellence to focus on standards and guidelines for safe and clinically effective digital health technologies. And in this group, they're offering guidance, they're offering support, they're helping these apps, gain more advanced approvals in a faster time. They're recognizing that digital health is here and we need to take a larger role. And you could check out, if you're interested in more details, over on the top is a guidance document, last updated in 2022, that specifically discusses exactly what counts as a software as a medical device, what exactly would be monitored and fall within FDA regulation, and what would fall outside FDA regulation. All right, we're going to take a pause here for like a couple questions, and then we're going to go into the art of app integration. So please share any questions you have so far. And I'll take one or two.
Thanks, Rachel. We don't have any questions in the chat right now, but we can pause for a little bit and see if anybody has any that they'd like to put in the chat.
Sure. Okay, we'll keep those questions. Feel free to enter them in the chat and we'll definitely have time at the end. All right, now on to the art of app integration. One of the key things I really want to emphasize here, when we think about integrating apps into practice, simply recommending an app doesn't change outcomes unless education, training, and follow-up are provided. This underscores the importance of us, of the dietitians and other healthcare providers, to provide proper onboarding and offer ongoing support for the apps. I want to introduce everyone to the Identify, Configure, Collaborate framework, known as the ICC framework. This framework was developed by the Association of Diabetes Care and Education Specialists and represents a standardized approach to leverage technology to improve care. And we could really use this framework for other health conditions because it speaks so well to the importance of the collaborative process with both the person and healthcare professional. The framework begins with Identify, where the dietitian assesses needs and goals to determine the right technology for the person at the specific time in their healthcare journey. Next is to Configure. This is the point where the dietitian configures the technology to the individual according to their preferences and treatment plan, right? As we all know, individualized care. The last step is Collaborate, which emphasizes a shared decision-making approach to develop goals with the person and support ongoing use of the technology. It's important to note that this is a continuous process as patients' preferences, conditions, and technology preferences change over time, right? Someone might try one app, it works for a while, they learn what they need, and maybe down the road they try something else. So I want everyone to think about how we can use this framework for integrating apps to support data-driven care. So in this part of the art feature, I'm going to walk you through some key factors for you to take away within each of the categories as it relates to apps, starting with identify. So here we first need to understand the person's biggest challenges in meeting their health goals. For one person, it might be a desire to lose weight. For another, it might be remembering to take their medication, right? We know it's different for everyone. Then learn about their unique goals and preferences to help you individualize their care plan and selection of apps. Then assess technology and app use. Find out what activities they use on their smartphone. This can help you understand their comfort level with technology. Do they use, Uber? Are they using apps for shopping or grocery delivery? Once we know more about their current technology use on their smartphone, we can dive a little deeper into the conversation. We can ask, have you ever tracked any health data or used apps on your smartphone? What have you used to help support your health? We can also help to uncover any barriers. Lastly, think about how apps can be used as a tool for M&T. I really encourage you to think of them as part of your toolkit. When individualizing app selection, I've kind of considered four main kind of categories of what I think about. The first category is availability. Think about where the app is. And I know someone I think had in the chat, right? Free apps versus ones that cost. That's a very important consideration. The main categories are free, available in the app or Google Play Store. There could be a cost to the app directly, or maybe an in-app purchase, which might, remove some ads or offer some advanced features. And the last category are those that are available through just a payer, employer, or clinic, or maybe subscription-based. So my personal thought is if we can get an app that's helpful for them, that's free, for sure, that's the way to go. But it can be helpful depending on if maybe you've tried an app that you say this is so worth it for that specific person, and maybe you can share that with them. But I always like to try the free versions, and oftentimes there may be an in-app purchase for an advanced feature, but which could be something to consider. But definitely, I always like to start with free. Next, think about what health information is tracked and how it relates to the person's current health management and preferences. For example, is it someone who needs to monitor their blood pressure and maybe using a connected app could help offer some more insights? Or is it someone who's looking to optimize their athletic performance and wants an app that helps to track their exercises and nutrient intake? Data integration and sharing is another important consideration. You may want to find out what devices the person is already using because it can be helpful to recommend an app that integrates with it. And I would argue it's really a slam dunk if the app can integrate with all the different devices. Let's say the person is wearing a continuous glucose monitor. They are using a smart scale. They've got a wearable fitness tracker on. Does this app integrate with all of it? That way they don't need to go into different apps for the different health components. How can we track it all together? And lastly is credibility. As I mentioned earlier, clinical evidence is growing, so consider apps that have research or are pursuing research, which certainly adds to their credibility. Look to see if it's FDA approved, but remember, apps that are focusing on self-management behaviors, general lifestyle, are exempt. And look into the company, look into the founders, who's on their advisory board to help give you more confidence in being able to recommend it. Next is onto configure. When I think about configuring an app, I've really thought about a 5-step process that kind of has come naturally in practice. So let's go through each one. The first step is what can be really helpful with the person is download the app with them. I can tell you so many times if we're saving our recommendation, oh, try this app, at the very end of our conversation, it's unlikely that they're going to go download it themselves. So I encourage you in that visit with them, go up on the App Store, look it up, and download it with them. And I will tell you, the setup process might not always be so smooth as people encounter barriers like forgetting their login credentials or have limited storage space. And I could certainly myself attest to that. So make sure to allocate enough time to get through this step. Next is personalize the account. This could include setting up a basic profile, which could include information maybe about their glucose targets, medication, or setting reminders. Next is to connect to those smart devices, right? So I talked about earlier that having those connected devices can be extraordinarily helpful, but it often might not be just a quick click. The person might need to allow data sharing. If they have Apple Health, they might need to go onto the app and the other app and make sure data sharing is on to allow the data to flow through Apple Health. So there might be a couple different ways to share the data. So again, it just kind of takes some time and you just kind of have to do it because each app is slightly different. And certainly for people using a iPhone versus Android, different sharing might be slightly different. Step number 4 is consider how the person is able to share the data with you. I'm seeing more and more apps that do offer, let's say, a clinician portal or allow the user to directly export their data. So that can be incredibly helpful to not only help the person in their day-to-day using the app, but how can you bring it in, right? That really key collaboration component of how the data can be shared with you. So some examples of how data is shared could be viewing the app directly from the person's smartphone, right? So if there is no kind of direct connection, looking at the app with them. Some apps allow individuals to generate a PDF or Excel report from the app, which they could then email to you. In this example here, the user can simply click that export button right here on the top left, where they can send it via email or fax. And in my practice, we often have them send it to our medical assistants who receive it via email, and then they then upload it into the medical record so that it's available for us to view during the visit. Other apps use an individual identifier or clinic code to facilitate sharing between the person and provider. Once they've shared the code, typically the data is always shared in real time. It's kind of like a one and done, sharing the code, and then we're always connected. And for more advanced options, direct integration with the electronic health record may be available. And I'm curious if anyone has seen this, because this is definitely, I feel like, the way of the future, but it's expensive, it takes time. And if you're like me working in a big medical institution, right, there's a lot of different levels for approvals for this to take time. But we are seeing apps working into this because they know it's so much more seamless to be able to have it right then and there in the medical record. And the last step here is to test drive the app. To build that person's confidence in using the app, it's helpful to do a test run during the visit. Maybe review 1 or 2 key features with them. Maybe they're using a photo-based app and they're going to take a picture of their meal, and maybe they don't have a meal with them, but they have a glass of water. I had this exact example. So the person took a picture of their water so they could see how they would log it. And I can't emphasize enough, taking those few extra minutes to guide them to use 1 or 2 key features that really can benefit them could be very helpful. And lastly is on to collaborate. Here is where what I like to say the magic happens. In this step, the clinician can review the data collaboratively during visits, virtually, in person, or even between visits, especially if that data is automatically being integrated, right? They can hop onto the healthcare provider platform and see the data directly. And this data can be so helpful to facilitate our discussions and support shared decision-making to promote positive health behaviors. So now I'm going to take you through 2 case studies that really put it into practice. So meet our first case study here. We have Julio. He's a 42-year-old male with no major past medical history. He comes in with concerns about gaining weight and building more muscle. I ask about his meal plan. He shares with me breakfast is butter on a white roll, sweetened iced tea throughout the day, and he says, I know I need to change my diet. Right? I'm sure many of us has heard this before. We know behavior change is hard, right? And he's got a little one there. So that's pretty much been keeping him really busy. His activity is chasing around his baby. So we talk about some strategies, we talk about goal setting. but to really help build that accountability. We agreed upon logging meals on MyFitnessPal as an example app to track his food and exercise for at least 5 days in advance of the next appointment. And we schedule a telehealth visit 2 weeks later for data review. And I want to highlight here, not expecting the person, I always say, I don't expect you to log everything, suddenly you got the app, you got to do it all the time. Be gentle when we're thinking about new technology. When we're thinking about any change, as everyone knows here, change can be difficult and changing habits. So starting with, at least some of the days. And I always say, some data is better than no data. So during that telehealth visit, I pull up the MyFitnessPal data, which is great because we were able to connect. So that way I could look at his data. And number one, always thank the person, right? I thank him for using the app and I remind him that it's information. It's not good or bad, right? The more information, this just helps provide context. And I ask about his experience. And he shares with me the app wasn't as hard as I thought. And he said the accountability piece was helpful. I then ask what questions or concerns you have about the information. And he shares with me he was surprised how many carbs and sodium were in his Chipotle bowl. So again, kind of having advanced awareness by having data and information from certain foods that are showing the different nutrients. So then we review data collaboratively, and I always like to start with successes, right? We want to be positive about this, highlighting a couple key things that he's been doing and looking for patterns and trends, which again can be incredibly helpful when people are logging food rather than trying to remember what they ate over those past 2 weeks since our last visit, or more often than not, right? Maybe even 3 months since our last visit. So in this example, you can give positive messages and personalized feedback. Way to go. Based on your MyFitnessPal data, I can see Mondays through Wednesdays, you drank at least 2 liters of water. He was working on switching from the sweetened iced tea to water, and he met his protein goal. Finding out through these open-ended questions, right? What helped make you successful? How could we replicate what you did on those days for other days of the week? In this next example, we have Tiara. She's a 34-year-old with type 1 diabetes for 16 years. Her A1C has been hovering in the 8s, and it's been pretty stubborn up there. We've been really trying to get her to the goal of under 7%. She's on multiple daily insulin injections, and for her short-acting insulin Humalog, she's using an insulin to carb ratio and an insulin sensitivity factor to determine how much insulin to take for her meals. She's using Dexcom 6 continuous glucose monitor, and she describes her meal plan as loosely carb counting. Physical activity involves Pilates twice a week, but she shares with me, other than that, she's pretty much glued to her desk as she had just started a new job. So we talk about strategies and carb counting. How can we help her to try to be a little bit more specific with the carb counting, knowing that some of her glucose levels have been high after meals? We know that it's going to be hard for her to get up and move, but maybe are there certain strategies if she does have a couple minutes to add a couple steps or just really getting up and standing? So we think about apps, and she's shared with me she's tried some of the typical nutrient counting apps, and it was really time consuming for her. She'd often have to enter, as many of you know, some of these apps, every single ingredient. It takes a lot of time. She just didn't have the time. So we talk about other apps, including ones that's photo-based, where we don't necessarily need to count every single nutrient, but really help provide a visual tool. So the app that was mutually agreed upon was Under My Fork, where again, we worked on using it for at least 5 days before the next appointment. So during that follow-up visit, we thanked Tiara for using the app and asked about her experience. She liked the Dexcom integration where she could quickly see the food from the pictures and her glucose levels directly on the app. And she liked the ease of use of the meal photos. We also then talk about some of her concerns. She notices a lot more the numbers are always high after breakfast. So this is great for us to kind of hone in on an area that she's concerned about that we know can also help her by helping improve her time in range. So we orient Tiara to the data and review some key concepts. I could see here that generally for that breakfast meal, I can hone in specifically when she started the meal and where she ended the meal. And this is showing her glucose levels. And you could see kind of there's a wide variability, right? So not really as flat and narrow as we would want. What I also like to show here is that she's entering information. So that's great. She's utilizing the app. She's interacting with it. So this is going to help provide some advanced insights. So we want to focus on the positive, right? Always first. So we look at the data from the app, and I love this, right? As dietitians, we could actually see what's on their plate and really see how many carbs she inputted, how much insulin, alongside the glucose trends. So we can kind of highlight here, if you look over at the bottom, when she had the whole wheat English muffin with eggs, you can see her glucose level was much more in range than the days when she had the bagel with cream cheese or the English muffin with jam. So having this visual, and again, I love sharing my screen, showing it with her, asking her, what does she notice? What were some key features? And she shared that, she had this bagel, it was at the office. She didn't really have time to think about the carbs. She kind of roughly estimated, but being able to see it here, she could really identify that maybe she could have put more carbs in. And I don't know, many of you are in New York, but the New York City bagels, let me tell you, are much bigger than usual and can have a lot of grams of carbs. So this, again, really was an opportunity to focus on some areas for improvement, see what's feasible for her. Might not be easy to have eggs every day, knowing that that helps kind of keep her nice and steady, but what could she do on the days when it might not be within her control? So we worked together to develop an action plan. We looked at what she learned from her data. We reflected on some strategies of things she would like to work on. She shared less carb guesstimations, adding more protein to breakfast. She shared that she wants to walk more, especially after meals, right? Knowing that that's a really excellent time to help reduce that postprandial spikes is by getting in a little bit of a walk. And we agreed upon an action plan that she felt comfortable with, substituting that bagel with cream cheese for a whole wheat English muffin with scrambled eggs twice a week. That was reasonable for her. Getting in the walk in a specific actionable way. And again, that ongoing support. Let's take a look at the data at a follow-up visit and see where you are, see what challenges you're facing, what are some successes. So with that, I actually got some real quotes from the patients that I work with, asking them, what has been helpful? What do you like about the apps? Patients share with me they're convenient. They love the personalization components, which enable me to choose and customize the app to my needs and preferences. Helps keep me accountable, helps with motivation, right? We know that is so important for keeping people engaged with their health. I want to highlight the bottom here, visualizing progress, ease of sharing data, more confident in certain healthcare conditions. And feel free to share in the chat too. If you've been using apps, what do they like about it? And you could also share what's been challenging about them too, because again, there's a lot to learn. These apps are continuing to evolve. The companies would probably love to hear your insights because they're always looking to better the company and better themselves and ultimately meet the needs of people. So I want to leave you here with some healthcare professional guidance. The ADCES has some great practice resources for those working in diabetes and cardiometabolic space about supporting digital health tools for people. And again, it really can apply to other health conditions too. It's a great handout that actually walks you through some key steps. Additionally, I've authored 2 publications here. Fueling Your Appetite, you have the reference here at the bottom, an introduction to nutrition and diabetes apps. And my most recent one published last year, Embracing Diabetes Apps in the Digital Age, a guide to integrating apps into your practice. And that strategy really walks you through what I've talked about with that ICC framework that, again, could be applied to multiple different health conditions. And what does the Academy say? So our Academy does have a position paper on nutrition informatics, which is at the intersection of information, nutrition, and technology. And what I want to really highlight here is that this paper emphasizes the importance of nutrition and dietetics practitioners to continually learn and update their informatics knowledge to remain at the forefront of nutrition practice. And again, there's no better time now to embrace technology with, AI evolving more and more. It's really crucial for us to think about technology and think about apps as it can help support efficiencies in our provision of care and also help support the person to reach their goals. I've briefly touched upon AI and just want to highlight we're continuing to see tremendous growth with the growth of chatbots, advanced algorithms, patterns and recognition, population health models. And the more data that gets inputted, the more that AI can help to provide advanced insights. So stay tuned on that. These are some ways to stay up to date, thinking about professional organizations, the Academy of Nutrition and Dietetics. I encourage you to think about, read through what's going on in different professional societies within your health field. I had mentioned earlier, right, that position paper within diabetes alone. I would imagine a lot more exists outside or is being developed. Conferences and events are great ways to stay updated. Looking at company websites, reading app reviews, again, also gives confidence around using it, and follow the FDA for updates on their regulations. So in summary, digital technologies are driving significant changes in healthcare. And over on the right here, apps offer a promising opportunity to enhance health outcomes. And I want you to leave here thinking it's better to consider digital health and apps not as a self-service product, but as a tool to work with the person together. Then outcomes will be more significant and long-lasting. Use frameworks like ICC to help integrate apps into nutrition care. And one of the best ways to start getting comfortable with them is to try it out yourself. I challenge everyone on the call to download a new health app and try it out, because that helps you to understand the different features, that maybe some concerns, maybe help you to understand what people might benefit most from it. So thank you so much for your time today, and I'm looking forward to the Q&A.
Thank you, Rachel. This was great. We do have a few questions that have come through in the chat, and feel free to keep asking in the chat if you have additional questions. But first, just curious why obesity was not an option of the top reasons apps are used. I would think this would be the #1 reason.
I completely agree with you. As we know, more and more, especially with the growth of these GLP medications, obesity is a disease. And in the publication that presented it, it wasn't included as specific to obesity. And I think it might be challenging because, if you think about apps, Weight Watchers or Noom, they're not necessarily geared towards a specific population, even though they benefit people with obesity. So maybe it's difficult to kind of categorize an app that's specific to obesity. Although in the past year alone, I would say we're seeing a lot of these. This paper of that result was in 2021. So I haven't heard of an update, but I would imagine that I really kind of think of like a cardiometabolic care, maybe thinking about the whole picture. As we know, diabetes and obesity, cardiovascular all go together.
And do you know of an app available via health insurance that tracks mental health or wellness?
That's a great question. So, there's a lot of really great mental health support apps, and a lot of them using like cognitive behavior therapy. And some that are more general, but I'm not, again, I don't have the answer exactly if a health insurance plan is covering it, but what I can tell you is that that's a very important way for apps to get in the hands of more people and help support their own revenue too, is that an insurance company would pay knowing about the important benefits. I would look into like Headspace or Calm, maybe some health insurances do offer that. In a similar note, I've noticed that for New York State Medicaid patients outside that, some of them do get WellDoc, which is only available through an employer or health insurance or hospital plan. So in that case, it is available by their healthcare insurance provider, but not specific for just mental health. Oh, I see someone in the chat said the VA has some free CBT apps. Great. Yeah. So I think it's state by state, city by city. Of course, it varies so much between different insurance companies. But the other thing is some patients don't even know it's available. So I think that's also an important tool, is asking them to find out, what tools do you might even have available with your insurance company that could benefit their health.
Certainly requires some research on both sides to find out what's available in your area.
Yes.
One question about challenge with continual use of apps. After a time, patients may log food, but not really analyze the data anymore.
Yes, I completely agree. And that's why there is a high percent of people that do abandon apps after they've used it for a while. And I think that is a big challenge for these app developers to continuously provide information and knowledge and engagement to help support them. But also recognizing that an app in a short term, if that's helping the person understand their food patterns and their eating habits that they can then take with them for the future, then that's okay too. Not all apps have to be used in the long term.
Great point. And do you have any advice on integrating technology into the care of older adults or those less tech savvy, but who would ultimately, it would improve our ability to care for them?
Yeah, I think that is definitely a big challenge. And I would also say I wouldn't always bucket older adults into not being tech savvy. I mean, I've had a 90-year-old being able to connect to telehealth visits and share his blood glucose levels. So you never know. But I think it does involve teaching and training in supporting them. If they have family support, that can be really helpful to maybe just get them started on an app, because once an app is downloaded and once the connection's going, that could help it become easier for the person. You might also want to consider apps or only like a certain feature of an app. Some of these apps have so many different things, but for someone who's less tech savvy, it's okay if they don't use everything. I also like to think about apps that do more color coding or have like voice features. So again, just kind of experimenting to see what might fit the needs for those who might be less tech savvy.
Great. And one final question. I know you touched on this a little bit in your presentation, but your thoughts on free apps versus apps that you might have to pay for.
Yeah, personally, I think if we can find a free app that is helpful for the person, I feel like personally that's kind of what I always go towards. I do have some people that pay for apps and they really find it helpful. So I'm happy to support them on it too. But I think it's also helpful to try out the app yourself to see if it's really helpful. And some companies might be willing to provide you with a free access for 30 days if it's a paid app that you're not ready to pocket, $30 a month, but you're a healthcare provider. It wouldn't hurt to even contact the company to see. So that way it will give you more confidence in recommending it. Because for me personally, it's hard to say, pay this amount of money when, unless you've really tried it out yourself.
Great. Thank you again, Rachel, for a great presentation and for answering all the questions. And thanks to our participants for joining us today and for all of your great questions. OneOp would like to invite you to an upcoming webinar on February 27th at 11 a.m. Eastern titled Food as Medicine, a National Strategy on Hunger, Nutrition, and Health, presented by Dr. Andrew Bremer, Director of the NIH Office of Nutrition Research. You can come to this webinar to learn more about the national strategy on food as medicine and explore your professional role in expanding access to food as medicine programs. We will put the registration link for this webinar in the chat, but it's also linked on the slide here as well. One continuing education credit for this webinar is available from the Commission on Dietetic Registration and the American Association for Family and Consumer Sciences. Certificates of attendance are also available. We are putting a link to the webinar evaluation and to receive your continuing education certificate in the chat right now. You can also go to the event page to obtain your certificate. On the event page, you will find the purple evaluation link. After completing the evaluation, you will be directed to select the appropriate CE opportunity and fill in your name and email. Your certificate will be emailed to you. Please note that some email addresses will direct the certificate to the spam folder, so please check there if you do not receive your certificate. And if you have any questions about your certificate, please contact me at the email listed on the slide, oneopnutritionwellness@gmail.com. A recording of today's webinar will be archived within 48 hours to our YouTube channel, which you can access via the event page. And be sure to visit us at our website, oneop.org, to explore upcoming events, articles, resources, and more. And you can also find us on Facebook, Twitter, LinkedIn, and YouTube. We'll stick around here for a few more minutes for those who may need to grab any links or information from the chat. But thank you all again for joining us today. Thank you, Rachel, for a great presentation, and we will see you next time.